Welcome everybody to our Heart Trending series. This is May edition. I'm really privileged and also honored to have Dr. Bill Lombardi. Dr. Bill Lombardi, he doesn't need introduction. He is a leading expert in complex coronary disease therapies. He is world renowned for chronic total occlusion techniques and PCI technology. Has published multiple manuscripts and book chapters and books about this. So beyond clinical innovation and clinical skills, and as a leader for interventional cardiology, he started recently a leader in mental health through a podcast called Journey to Better. I highly recommend it to everybody to go check it out on Spotify, iTunes, all the platforms that you're aware of. Also, he received his medical doctorate from Tulane and holds a board certification in interventional cardiology. But one of the highlights, he is professor of medicine at director of at the University of Washington Medical Center, and in 2023, Dr. Lombardi earned the prestigious Hartzell Award as Master Operator. Outside work, he enjoyed family outboating and also exploring the outdoors. But more importantly, I see his career and how he developed over the course of many years, all his clinical experience coming down to tell us how to practice healthy, how to be more efficient, but more importantly, how to be self-conscious about what we do every day. Dr. Lombardi, thanks so much for being with us.
I appreciate being here, and I'm looking forward to the conversation. I think it's a very challenging topic for a lot of people to talk about because there's a lot of negative stigma around this topic at times. So looking forward to talking about some of the challenges that occur both in our professional and personal lives that make it difficult to stay healthy.
Absolutely. So Dr. Lombardi, do you want to share slides or are you going to be discussion back and forth?
I was assuming we're doing a discussion. If you want, I can do a brief talk. It's really what you prefer. I mean, it's sort of, in some ways, I know if there's people out there, I'm really curious what questions they might have, and sort of we can let the topic develop itself.
Number one, the most important question, I think the burning question is, you came from as a prestigious operator, high volume, complex coronary, teaching everybody how to do CTO, which is kind of considered the top of the line interventions. And then from that platform, you realized there is something missing. Tell us about that transition and how do you see, what you evolved over the course of time?
Yeah, so it's actually probably more personal than that. So in 2021, sort of as the pandemic was winding down, one of my partners got hurt. I picked up the work because that's what we do, right? We take care of the patients and you just work harder and harder and harder. And then when they came back, I'd been planning for a while to take a leave of absence with my kids before they went off to college. So my wife and my kids, we went and took 3.5 months off. And part of that was to hopefully build a better relationship with my kids, build a better relationship with my wife. We had a lot of friends come and visit. And when I got back in September of 21, my wife basically looked at me and said, I want a divorce. You're a horrible person. You need to quit drinking. And that was the start of this. And the way I tell people is I'm world famous Bill Lombardi. I'm professor of medicine at the University of Washington. I'm on faculty and do live cases. I've got volume out the kazoo. I make lots of money. I had a beautiful wife. I have 2 kids, a beautiful house, a boat. My life is perfect, right? From the outside, it looks perfect. Yeah. But from inside, I was a mess. And I think that's a lot of us from the outside, we look okay, but the inside, we've got a lot of challenges that have been programmed into us through our training and also sort of the personality types that go into medicine and cardiology. And so for me, go ahead.
So when you said, quote unquote, you are a mess. So is it something because your wife told you that, and it was, you are so laser focused on what you do every day, and you are kind of not ignoring, but you are completely canceled out of all what's happening around you at the house? Or she noticed something different in you that triggered that conversation?
No, I was broken. It wasn't laser focused. It was emotionally broken, right? The intensity of the cases, the intensity of work, the intensity of travel, the, the decisions that you're making, um, really mentally break you down. And so I had to start therapy, marriage counseling and personal counseling. And as I went through personal counseling, you start to realize all these other people and things you're either avoiding or blaming are actually your problems. And you have to start having ownership. And so for me, as I've talked about this with a lot of people, the emotional toll of our job is ignored, right? People people die in this job. The pressures to produce RVUs and volume in an
Mhm.
increasingly system designed to make you less productive, you end up in a lose-lose. And
Yeah.
the the competitiveness in our profession actually hurts us because instead of raising those up around us, we tend to put those down to keep ourselves raised up. And so all of that leads to we tend to not and we have a profession where you're supposed to be perfect, right? You don't share emotions, you don't share your flaws, you don't show
You can.
vulnerability.
Yeah.
And so that was for me was I realized that I was emotionally broken. And as I went through my therapy, I felt the need to go out and discuss this with others because lots of people in our profession are broken and we're not talking about it, right? The suicide rate of physicians is double the normal population. And we're actually much more likely to succeed because we know what we're doing. The burnout
So
rate
you
in cardiology right now is 50%.
perfect. That's what I want to talk about. Especially, we're going to dive a little bit deep into interventional cardiology. I feel there is a lot of ego, a lot of pride in the interventional cardiologist because of
Yeah.
what we do. We behave like a surgeons, right? We can walk on water, we can fix this and treat patients and heal people. But deep inside, as you expose yourself way more than anybody else, is also this comes with the cost of dealing with complication, and which is this is part of the business and the industry we're in, and also mortalities and others. So you are way deep into this. So we have a lot of young people on the call, people who are just starting fellowship, people who, practice, people who are thinking about interventional cardiology.
Yeah.
We don't want to discourage them, but what is the slippery slope to get into all this too far that we, we want to avoid this from happening early on?
Yeah. I mean, honestly, early on or late, the things that we have to work on is I would describe it as there's a lot of ego and there's a lot of extrinsic validation that we use to emotionally support ourselves. And what you will hear with people when something goes wrong is not a bad thing happened, it's I'm bad. That's why we have lots of risk aversion because we don't want to feel bad because we feel bad. And so there's an interesting book if you're interested called Worthy, and it talks about worthiness. And worthiness is actually an intrinsic self-support of who you are. And
Mhm.
so for people out there at any point in your career, what you really need to be is you have to feel worthy. You're a good person. And whether you're the most successful interventional cardiologist or the not has nothing to do with your worthiness. And when a case goes wrong or something doesn't turn out or it isn't as good as you think, that doesn't affect your worthiness. That is something bad happened. So the way I would try to tell people is you're an interventional cardiologist, great. And you have a great thing happen, that doesn't make you more worthy or less worthy. It just means a good thing happened. If a bad thing happens, I'm a good and worthy person. and a bad thing has happened. And the way I should view that is, was the decision making that led to that good or bad? Can I learn from it? Can I improve from it so that we get better and better and better over time? And in that piece, the good and bad outcomes aren't reflections of me as a good and bad person. They are reflections of my learning curve to get better.
Do you think all physicians go through the same thing we go through as interventional cardiologists, or there's difference in specialties in terms of burnout?
I think everybody goes through it in a variety of ways. I think the 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 cardiac surgeons, the ER docs, us in interventional cardiology, and to some degree maybe neurosurgery and vascular surgery, but any specialty with a high acuity of people dying in front of them and or as a cause of what they've done are going to have higher burnout difficulties. OB-GYN's probably in there too, because when children, when babies have a bad outcome, there's a lot that goes on in that too. And I think that, again, it comes back to is we are good. We're trained.
One question came up is,
yeah.
Go ahead, finish your thought.
We're trained to compete. And
yes,
but what we're competing for is RVUs, volume, and ego. And all of those end up leading to the way you compete is you beat others. Why are we as doctors trying to beat other doctors? If we're trying to help patients, shouldn't we have care and compassion for each other and care and compassion for patients and help them get better? So that the system is incentivizing us to beat on each other. And then, hospital administration will manipulate that to their advantage. And we sort of have to step back and realize what we're doing to ourselves is unhealthy.
Yes. I just want to remind the audience that if you have a question, please use the Q&A box or the chat box. We'll be happy to answer. And please ask as many questions as possible. Dr. Lombardi here to talk about, he's a life coach. He can coach about what needs to be done to survive and have a healthy practice as well as profession and career down the line. Now you mentioned something about the competition. And this is very important because I used to have something back in 2020 and 2021. There's a lot of pressure from social media, and I called it the Twitter pressure. They see a paper from somebody, I want to do the same. It puts a nice case, I want to do the same. It's a peer pressure on social media. And I know I can mention 10 names now. They dropped off Twitter because of that pressure. They said it's psychologically unbearable. I cannot watch it anymore. Mm-hmm. But that speaks to your point about we are competing with each other. I don't think it's a healthy competition. That's on the national and social media platform. Now, so how can I balance as a young or mid or kind of late career, balance having a good productivity in a practice where I am satisfied with my job that I signed up for, but yet have also a good life balance with seeing my kids, the games they go to and the practice they go to?
Yeah, I guess one, realize everybody out there, you're in the top 1% of earners in the country. So stop comparing yourself to other people and am I making enough money? You're getting paid a ridiculous amount of money to do a very privileged job. And within that then is you have to set boundaries, right? And the boundaries are when asked to do something, what hospital administrators, other people do is, well, don't you care about the patient? The answer is yes, I care about the patient, but you know what? There's always another patient. There's always another thing. And you have to understand you're programmed to say yes to anything at work. But you also have to recognize that with every yes, there's a concomitant no. So you're sort of valuing the yes, but rarely do you look and value what the no means. And so I think it's very important for people, if you want to evolve, you have to start understanding the consequence, not just of the yes, but the no that goes with it. And then look at what your values are, and are those in alignment with your values? And if they're not, you're gonna end up in a broken headspace because you're gonna say yes to the wrong things. And I will
How
say
do
again,
we
please
have a
call
question
me
coming from
just
from
just please call me Bill.
there's a question I think really touching.
Yeah.
Absolutely. Thank you. Absolutely. Yeah, I see that. So, Bill, there's a question here coming, really touching on this point specifically. He said, "This anonymous, uh, I love going to work. I love doing intervention. I love reading. But my wife told me that the more you're sitting in the hospital and my studies away from my children's milestones will eventually lead to me burning out and cause depression. How I can balance between do what I love and yet I don't burn out." I think we're
Yeah.
already talking about it, but
Yeah.
specifically because this is a burning question for us, for people. We want to do stuff. We want to do the cool stuff. We want to not do more RVU to get more money. Yeah, maybe there is some motive for that, but also I want to do the cool stuff. And sometimes you have to stay late and miss the stuff. So here, I mean, how you can balance that?
Yeah. Two things. One, in a little bit of it comes to worthiness. When you're saying that, what you're talking about is the heroine of the job. Look, I did something cool. Look, my patient loves me. Look, I'm amazing. What you're trying to do is take extrinsic validations to prop up
Yeah.
yourself. And the other is, and as I guess my goal is to become a life or leadership coach. So I'll tell you, one of the things I try when I work with people is, all right, if you had to sit there and say, here are my three most important professional goals or values, and organize them, right? Because you love your job, right? So I'm going to stay late because I want to do the cool case, and I want to do this, and I want to do that. So these are the three things I want to do. Okay, great. Now take the time and write down the three most important personal things. I want to see my kids play soccer. I want to go to the school recital. I want to have a date night with my wife so we stay connected. And then prioritize those. But then the really difficult thing is, before it actually happens in real time, is take your professional goals and your personal goals and prioritize them. So, is my choice to stay late and do another case, or the choice to go see my kids' baseball game? Well, which one of those is a more important yes? And, for me, if you want to stay mentally
It's obvious,
healthy,
and the answer is obvious.
but
Is
but in the
as you
but
said,
in the
it takes a personal drive to do it.
but you gotta, if you don't do that exercise, when confronted at work, you will always say yes to work. And so to me, the key in this for people out there listening too is there are lots. I mean, I can mention there's a million books that have helped influence me, and I pull little quotes and things from a lot of them. And one of the quotes that I heard on a podcast that I enjoyed was, many of us have information, right? It's like reading clinical trial data. We have lots of information, but information in and of itself does not lead to transformation. It's actually application of the information that leads to transformation. And so if if your wife is already telling you you're working too much, you've got to make some decisions. What's more important, your job or your wife?
Yeah.
And if it's your wife, you need to start setting boundaries about work. We did a podcast on this with the most famous person in this, was Robert Riley. So Robert went to the Christ. He was, amazingly famous, huge volumes, doing awesome. And his wife said, I want to move back to Seattle. I hate Cincinnati. So he had to quit his job and take a job that's not nearly as prolific or podium presence to get his wife back to Seattle.
Mm.
That was a really hard choice for him. And I'm really proud of him because he showed great moral certitude to do the right thing for his family. Most of us don't have the emotional intelligence to do that.
Absolutely. And that's, as you said, you are breaking your ego to make that decision. One question came: is the system is an issue? Does it enable the competitiveness? Meaning, is there a profit versus non-profit? Is there a solution for that from the workplace standpoint?
Um, I, so this has nothing. I mean, the nonprofit hospitals are the ones that actually are the most greediest. Um, so I think the system issue is the way that we've incentivized or defined success in our profession. RVUs, volume, ego, title is a systemic problem that we really don't have the ability to change in a meaningful way. You'd have to legislate it to some degree. So for us to deal with it, what we have to do is confront it. Effectively, the system we grew up in medical school and residency and fellowship and life is bullying. You have been programmed to act this way without knowing it. So you have to wake up, take the red pill, step back, and say, that's a Matrix reference for anybody out there. And you're like, no, I'm not, I don't want to be programmed like this anymore.
Mm-hmm.
I want to have compassion for my colleagues. I want to have compassion for my patients. And more importantly, I want to have compassion for me. And that compassion means, instead of doing an extra really cool case, I should go work out. Instead of doing an extra thing to make the hospital another X and me 12 RVUs, I should go to my kid's baseball game.
Yeah.
These are the things, again, these are those applications that are going to be very difficult because we become very comfortable in the hell that we've built. And we have cognitive dissonance. And when we confront this, we will tell ourselves, well, I can't do this and I can't do that. And that's impossible. And we'll make all of these lies up. In the end, the only person here who gets to make a choice about what happens is actually you. And how you respond to things and events is all that's in your control. Physicians love to be control freaks, and you have no control other than of your response to events that are around you.
We start to get some more question, Bill, is about we start to have a pattern of these questions. One of them, I think, summarized very well is, what are your practical tips to learn from procedural complication and how to manage their associated mental exhaustion?
So one, I'll put a pitch. Come to the CRF complications course, August 2nd and 3rd in Seattle, because it's 2 days of the mental, cultural, psychology, and for coronary intervention, all of the complications that could happen in a cath lab, most of which you may or may not see very frequently, but you're going to get algorithms how to deal with them. What I tell people is when you have a complication, there are a couple of things. Most M&Ms are not helpful. And the reason is most of the time, the people in the room aren't actually experts in the field. The second is someone usually in the room will start pointing the finger going, you shouldn't have done that. And I will tell you that's a bullying maneuver. And one of the ways to respond to that is you should look at the person and understand the response should be, are you saying that if nothing had gone wrong, then it was okay to do the procedure? Because what I want to understand when you say you shouldn't have done that case, that's an indications discussion, not a technical outcome discussion. So which do we want to discuss first?
Yeah.
The second piece is when you get to the technical outcome piece, You need to look at the decision making that led to the event, not the result. So even things that, like a case that goes well, you actually may have made bad choices. You just got lucky. The other thing I will tell people to manage the mental piece of this. So in our group, one of the things, we are not allowed to talk about the technical aspect of a case, certainly within the first 24 hours. All we do in the first 24 hours is give each other hugs. We ask if they're okay. We ask what we can do to help them. We let people cry. We encourage them to emote. We try to talk about how bad it feels, to not bottle it up and hide it. And only after the emotional piece is dealt with, which is usually between 24 hours, can be a couple of weeks, to be honest, or longer. And that's only if you have people you can safely emote it with. Then we talk about the technical piece to learn from. Because otherwise, you're not in a headspace to learn. All you do is feel, again, it goes back to I'm a bad person. You're not a bad person. You're a good person. You went into medicine because you want to help people and because you're a good and worthy person. So you have to separate the outcome from your persondom, for lack of a better term. I hope that helps. If not,
Now we
email
have a
or
lot of
call me. I'm happy
surveys.
to talk more.
Absolutely. Thanks, Bill. So one of the I every meeting now, every international meeting, you see a poster or a presentation about surveying interventional cardiologists and burnout.
Yep, on
Um,
us.
and there is a lot of data now. Yes, and there is a lot of data now. There is high divorce rate
Yep,
because burnout can be an umbrella for a lot of stuff. One of
yep,
them is depression, suicide, divorce. I think divorce is the most mild version of that. And also at young age with young kids. So this is a major trauma uh, driving this. So one of the question comes here, at what point do you stop competing with others and yourself? Is there, because people might, pardon me, Bill, they might say, oh, Bill have done a phenomenal career. He got what he wants. As you said,
yep,
the fame, the podium, the count, right? And now,
yep.
now he realized I'm just being, I'm not being as anecdotal as possible. And now he's talking to us about how to be mellow and watch the family and stuff. So how we can reconcile that?
Yeah. So I would look at it this way, and you can add to that list of signs of burnout, drug and alcohol addiction, which there's a lot of. Because a lot of times we're medicating because we can't deal with the emotional aspects of our jobs. That's all of the things you talked about is the inability to manage the emotions. The When do you get to decide not to compete? When you decide that you want to be healthy. The the success wasn't an outcome of the competition. First of all, when I started, my goal was never actually to be famous. This is all a bizarre thing for me. The focus was to get better. The the challenge was is I was very focused on getting better at work. And what I missed is I should have been working on getting better at home. I should have gotten better at being a human. By not competing does not mean you won't end up being successful, famous, wealthy, whatever. That's Don't let the system drive that to you. Being a caring, compassionate human, working on things to help yourself get better, the process will take care of the rest. And that's what you have to decide. And again, I'm not telling people to sit there and do none of these things and focus only on family. But what I want you to do is have the conversation with your wife and kids, or your husband and kids. I don't want to be sexist or even gender neutral, whatever partner you want to do. The key is are you doing this because it's the way you're programmed? Or are you doing this because you're actually being thoughtful, communicative, finding not necessarily balance, but managing that the work pendulum gets to go over here once in a while, the life pendulum gets to go over here. What you don't want to be is the work pendulum is here all the time. And that's the competition problem. So, yeah, it'd be easy to say, well, he was famous. The only reason I get to be here is because I had a platform. And the reason I'm trying to tell people is not to prevent them from, I'd love for people to be better than me at a lot of different things. I just became very fortunate that I have
absolutely.
a platform to share it. And the other piece is it helps everyone. If where I got in my life, you can end up that broken, normalizes it for everybody. We all can end up broken. The important thing I want to do is change the culture of our profession so that people don't get broken. There's none
Actually,
of
I know a recap on this thought because coming from you is as a successful academician, research papers, procedures, podium, is harder than coming from somebody who is a mediocre in the field. That's how we look at it. Because you are letting all this go, not letting it go. You're continuing to do what you are like, but balancing it a little bit and tell us what needs to be done. It means a lot than somebody who's really average. Because you are really telling us, really, it's good to have it, but I don't think it's worth it. That's basically the title of the book, as you said, worthy.
Yeah. Well, the funny part
is,
I
just want to shift gear a little bit.
I was just saying that
go ahead.
The funny
part
is
and then we'll shift gear. Yeah.
That the more that I've done this, the better I've got, and I've gotten more successful and more things. And I think that's the piece for people to realize is you will not know what the journey looks like. So stop worrying about the outcome. Worry about the process, the effort, and the thoughts. The rest will take care of itself.
I want to shift gear a little bit to the workplace. And workplace, I feel from speaking people, and this is an unspoken language in terms of people don't talk about it. I think as you started the webinar when you said ego or pride of the physician, there's a lot of pressure or bullying in the workplace that is, I think, is uncovered. Yeah. And people are not verbalizing that as much because they feel embarrassed if they do. And also they might be a target for more attacks within an institution or from outside. Do you think this exist? And if yes, what's your input?
Well, yeah, I mean, it's 100% exists. It's the problem. And the reason I'm out doing the podcast Journey to Better, the reason I'm out doing these talks, the reason I'm out showing is we have to change the culture, which is one of hierarchy and bullying. One of the reasons I want you to call me Bill is doctor forces hierarchy, right? And I don't want that. I want to be horizontal. I think that for the trainees, especially, right, they are super vulnerable to bullying. And we have to find some formats to let them emote, let them understand, and we have to find different triggers and ways to build better cultures. To me, medicine has very few actual mentors. And the reason I say that, and we have almost no leaders. And the reason I say those things is a mentor should be like a parent. Their goal is to see their student outshine them. But in general, very few well-known physicians have pupils that outshine them.
Yes, correct.
And it's because we use the pupil to make us shine brighter. And I think, the second piece that comes into that is that we have very few mentors showing unconditional love to the mentees, right? Like the people who come and do the CHIP fellowship with me, it's a brutally hard year. We do a ton of cases. I expect them to work super hard. I expect them to deal with a lot of stuff. There's a lot of expectation put on them. But they also know that I will always have their back, that I will support them to the best I can to help them succeed in the way they want to succeed. And I will show them compassion and unconditional love. And so when people talk about, well, the kids now just don't work as hard as we work, that's not true. They'll work just as hard, but we have to treat them differently than we got treated.
Yeah.
And that's a good thing, not a bad thing.
They don't need to go through what we went through or what you went through to be where you are now. There's easier way,
Right.
and there is much more benign pathways to get you what they are.
Right. I mean,
So
it goes back to this. Think about the behaviors you wish were modeled for you. And instead of modeling the ones that you got trained into being, resist that and model the behavior. Like if you're in a bad M&M and people are bullying you, just say, this isn't helping me. I'm feeling really bullied. You're not actually helping me. Could we have an outside review of this to help us get better? Right? Or, you're lazy because you didn't say, I'm really sorry. My choice was to go to my kid's baseball game or do another case. Which do you think is more important? Yeah. And it isn't that I'm going to go to the baseball game every time, but it's not going to be zero.
Yeah.
And I think
the problem what we do is we go completely, as you said, the pendulums completely go to the far right or far left, and we get sucked in that pigeonhole.
I would tell you it doesn't go far right or far left. It goes one way and stays there. We peg it. I mean, it is and again, it's a high acuity specialty. We have a lot of call. The call is hard. There's a lot of emotion. I mean, this gets back to, we talked about the complication, right? Or you talked about the bullying at work. Do you know who ends up paying the price for that? Your family.
Family.
Because what you do is you can't kick the dog at work because you're afraid of kicking that dog because you're in a strategically wrong place. So you go home and you kick maybe the actual dog or your partner, your spouse, the kids, because you don't know you don't have a safe place to manage that emotion. And I would just tell anybody out there, if that's happening, get therapy. And if you sit there and say, well, I don't have time, and make the time.
Yeah.
Because
that's going to be a spark for a disaster.
Yeah. It was when's the right time to quit competing? Now. You can be competitive and win without being a broken person. Right? Go look at Scotty Schefflin. He just dropped out of a couple tournaments, went home. He's going to play just fine. If you listen to people on their deathbeds, none of them say, gosh, I wish I'd done another case.
No.
The regret is always, I wish I had shared another memory. I wish I'd had another adventure. And there's an interesting way of framing this, but you can build CV attributes or you can build eulogy attributes. Which would you prefer? Make a very intentional choice what you're doing rather than a programmed choice to act a certain way.
This is so far is phenomenal. We have 20 more minutes to go. So again, for the audience, please post your question in the Q&A box. We'll make sure we answer them live as we go through. Another comment came, I think this is from trainee. They have young family.
Hmm?
They're underpaid, overworked, they moonlight.
Yep.
And to balance the financial burden, they're not getting extra moonlight shift is to drive fancy cars, basically to feed the family and get the rent and all that. So the pressure here is they think that this pressure is unbearable and reaching a point of high tension at home, but also they're worried about when they go to the job is going to continue. So how we can help them balance this from now on.
Yeah, again, another huge problem. I mean, another one comes up for a lot of the women in training are trying to figure out, well, when's the right time to have the baby? Right?
That's a good question.
Right? That's a big thing that comes up. And we just did a podcast with several women, and we were talking about sexual harassment, but part of it came out is the right time is whenever. There isn't a right time. And the financial piece of healthcare, I don't think I have a great answer other than do your best and understand there is a light at the end of the tunnel. You're going to get a job, and the job's going to pay you lots of money, way more than you currently make, and it's enough, right? I mean, $100,000 a year, most people in the U.S. would be very happy with that kind of income. We tend to want to look and compare ourselves to others, and usually it's the person above us, not people below us.
Mm-hmm.
And so, everybody at times sort of needs to step back and look. Hey, look, grand scheme of things, I'm pretty lucky. I've got a job. I make a pretty good living. I work my ass off. It's really hard, but there is an end to it. And at the end, there is a rainbow because I'm going to get paid, even in a bad job, a lot of money. And so I think I wish I had a better answer. I wish that the healthcare system, one, shortened training. We're doing training that's 100 years out of date. I think my personal opinion is cardiology should be a 1-year medicine internship, 2 years of general cardiology, and then into your specialty. And you should be out in 4 or 5 years max. We play a lot of Marcus Welby, MD.
It's switching training for too long.
Well, even the way that most interventional cardiologists practice is wrong. And the way I say that is you spend more time in clinic than a cath lab, you're a general cardiologist. It gets the privilege of doing intervention. And in the grand scheme of things, one person does not build a car. One person builds one piece of it really well. So really what healthcare needs to do better is, I said, I don't do structural. I have no desire. I've got 3 great partners that are way better at it. They don't do a lot of coronary work. You know why? Because they don't need to, because we have 3 great coronary people. And I think it's intrinsic on the systems over time is stop trying to be everything to all people. Is if you want to be better at one thing. You cannot be better at everything, right? Like how many people are professional baseball players and football players?
0.
Well, it was 2.
Oh, really?
Deion Sanders and Bo Jackson, right? That's it. It's not going to happen.
1,000.
Right?
Yeah.
You're not going to be the greatest structuralist on earth and the greatest chip CTO operator on earth. You don't have the time.
They oftentimes, I feel there is a lot of pressure in the trainees that I have to do a super fellowship. Like I finish interventional, I have to do structural, I have to do peripheral. Like why you have to?
Well,
is it something you'd like to wake up in the morning and do it? If not, then you're wasting an extra year for no reason. One of the question comes in, which is I think is very important, is you're speaking and you're asking us for cultural change within each individual. Do you think it's time to work with more at a bigger scheme of things with bigger scale with like ACGME, ACC, Sky to create a better, healthier pathway that dictate how we practice to prevent burnout?
If you can get them to, absolutely. I would tell you my perspective is revolutions can be run from, and culture change are much easier to run top down. They're much harder bottom up. But you have to remember the people at the top right now got there because they worked in the system in the way the system is. And very few people, by the time they get there, have enough self-reflection to realize, well, great, I'm here now. Now I'm going to do it totally different. So yes, I think ACGME should take this on. There was actually a bunch of stuff on wellness at Sky that is evolved out of some of the stuff that I've done in the podcast. And it was great. It was horribly attended. A lot of the fellows showed up, but there weren't a lot of people there. So the answer is yes, I think we should. And for you, if you have access to leadership or can start getting coalitions of people to build, I think it's great. That's really what we need.
Do you think, have you tried before to work with them and you didn't get where you wanted to go?
So I don't know the people that run ACC well enough to give you an answer to that. So I'm not politically connected to that. And I mean, Jim Hermiller's the president of Sky this year, which I know, and he's actually reached out to me to talk a little bit about this. So maybe we'll get to. I've most of my career, I've not been a very good politician for a variety of reasons. One, I'm not really political correctness kind of person. So
you have a huge crowd now, so I can tell you are a great politician for now. If you run for something, you have our vote.
Yeah, I think I still have an opinion, and it's still usually a strong opinion. I know how to word it in a softer, better way, and I'm much more authentic about who I am, which is I care about patients, and I care about doctors getting better. If you don't care about getting better, we're probably not going to get along real well. And I would just say that I don't have access to those resources, but I know as we talk about this more and more, there are people who do. And if you want change to occur, you have to have the courage to step up and ask for it. And you have to have the courage to start discussions. And whether the discussion leads to change or not actually doesn't matter. What we have to do is start having the discussions, which is what this is about.
So, Bill, if times goes back when you were a trainee, what you would have done differently to prevent your wife telling you we have to go through divorce?
Yeah. I would tell you I would have gotten therapy a lot earlier. When we did marriage counseling the first time, I would have stayed in it longer. I wish I had had more ability to self-reflect and also allow people telling me that I needed to change to listen to them. And I didn't very well. And I think that's
so
a
people
problem.
Told you before, but you didn't listen.
Yeah, I mean, right. I'm loud, I'm obnoxious, I'm passionate. You're hyper focused. You're traveling to. I mean, all of us that got involved in this were traveling so much, and all of us got in trouble with our partners and our spouses, and we didn't listen to it. We just kept going.
Yes.
And I think that the thing I wish I had done is I wish I had worked on my worthiness earlier. I mean, I mean the really where this comes from is I wanted to make my father proud of me. My father's been dead for 25 years, 25 years. And I wanted to make him proud of me. And by surrogate, that became, I wanted other people to be proud of me. And that was what was motivating. I wanted people to be proud of me because that was the only way I could feel good about me. And eventually it got to a place where there wasn't anything that I could do to get prouder. And then you look inside and you're like, there's nothing inside. There's, you know, it's like being a heroin addict. You keep hitting it, you get bigger and bigger and bigger doses, and then you die. And what you have
to ask you the same question
yeah,
in a different way.
okay,
If you have done the same thing you just told me now,
yeah,
would you achieve what you achieved today?
I have no idea. I really don't. And to be honest, I'm not. I would tell you is what I would have achieved is a happier life.
Happier life, yes.
What I would have achieved is more alignment of my values with my family and more alignment with my career.
Yes.
And in the end, that I might have even been greater, or I might not have. But again, the perception of my success is an outside measure of success. What I really wish I had is where I'm getting to now, which is I have intrinsic worthiness. I am a good person. I am now able to show grace and compassion, not only to myself, but to my wife, to my kids, to my partners, to the people on this podcast. And I can be confident in being vulnerable and emotive in a way that allows me to continue to do my job at an incredibly high level without the emotional toll and baggage that I was carrying around. And I think
Very,
that's the way I would view it.
very good question coming. What's your thoughts on meditation and wellness trips?
I just finished a book about prayer. I don't meditate in the way, I guess I tend to do my meditation while I'm exercising. So I tend to ride a bike and I tend to run. And sometimes I'll listen to stuff and sometimes I'll just stare at nature. Nature tends to be my spirituality. So when I get out, nature's good for me and I'll stare at stuff. But I think meditation is really good because it's about calming yourself. And all a wellness retreat is, again, it goes back to application of information. You're trying to transform and learn, how do I change my response to these negative things at work in a way that lets me stay healthier and stay happier and stay calmer so that I'm giving energy to the people who deserve it, and I'm not giving energy to things that are just a waste of time. The meditation trick I just learned, which I liked, is when you breathe in, you think calm. When you breathe out, smile. So it's calm, smile, calm, smile. And you try to do that for a couple minutes. And it's a really nice way to sort of clear your headspace and put you in a better frame of mind. Because we tend to just get wrapped up in anger. And I used to have epic anger management issues. I've gotten much, much better.
Bill,
And
one of the housekeepers actually in the cath lab gave me the best advice a couple of years ago.
yeah,
She told me, Shadi, maybe once in a while it's good to stop to smell the roses. It was a
yeah,
wake-up call, like what I'm doing.
yeah.
That she's seen in me that's so wrong to tell me it's fine to slow down a little bit.
Yeah, I was on a call with someone recently and they were getting kind of anxious and and there were lots going on in their life. And I said, is there a window where you are right now? They go, yes. I said, can you see a tree? No. I said, can you see the sky? Yes. What color is the sky? Blue. How pretty is it? And just stop, right?
Yeah.
It's about finding pleasure in short moments. And where I was leading to the anger piece is partly this. the intersection of negative emotions with positive emotions is curiosity. So one of the things when I started early on, when I was feeling myself getting angry, what I had to do is, why am I angry? And then, is being angry helpful? Can I change what's going on right now? If I can't change it now, do I want to spend the time and energy later to change it? And by the time I got to that question, A, I was no longer angry, and B, I really didn't care about what was going on. So it completely changed my response to the trigger that got me fired up.
Bill, we have a question. Can you say that you know now you know your limitation more? So now to where you are able to make better choices for your career and family life? This is a question actually for everybody. Have we done enough mistakes, I think, to the level to know what not to do going forward?
I don't think I think that's almost too black or white an answer, right? And the other is, you actually want to make mistakes. You want to keep making mistakes because that's how we learn, right? Think about, there's a famous quote, right? Why did this happen to me? Change it to, why did this happen for me? Because whenever something's going wrong, that's what's going to strengthen you and make you a better person. The hope that I'm trying to do through this is, make your own damn mistakes. Don't make the ones I made, right? There's a quote I like, which is, a smart person learns from their mistakes. A wise person will learn from the mistakes of others. And so all I'm trying to help people is help you get to a framework where you can go make some new mistakes. And maybe hopefully your rock bottom won't be as bad as the rock bottom I got to. And maybe if more of us can find the grace and compassion for ourselves, for our colleagues, then over time, the culture will change into one that's less bullying, that's less negatively emotive, that's less costly to our humanity, and allows us to be good doctors and good people and feel good about what we're doing at work and at home.
I have to reflect on something. Yesterday was mark a 4th year of anniversary for losing my 3rd child. And till today, I wish I spent extra hour with him. It's very hard, and I wish I spend more time with him. That's all I can say. I just visit him now, and I wish I can hug him more. I can kiss him in the morning more, but I can't. So this thing is really touchy, and it's hard. And I learned from that experience the hard way. Me and my wife. So what you're saying, Bill, is really phenomenal, and I wish nobody fall into the trap of the drive to do more, to work more, to get more money, bigger house. It really doesn't matter. What matters at the end is how much you spend with your beloved ones. That's what really care. We have 30 seconds, Bill. Final word and wisdom to the audience.
Learn forgiveness. So forgiveness is not about forgiving the person who injured you. Forgiveness is about letting yourself let go of the trauma. So Chadi, you just shared a really touching thing, and I'm really sorry for your loss, and I'm really sorry that you've had to go through that. I would tell you is, give yourself forgiveness to allow yourself to remember the positives and as much of the good as you can, and to allow yourself to continue to bring more of that into your life rather than continue to let it hurt you. So learn forgiveness.
Bill, that was phenomenal. Really, this is one of the best lecture I have attended without slide presentation. I think it's a life lesson. I'm really glad we recorded this. And for the people also on the call, don't forget that Dr. Lombardi has and runs a podcast called Journey to Better. Make sure you sign up for it. He always touches on these topics. about to manage your stress at work, life, how to become a better physician with the tools you have without hurting your beloved one and or your the things that you love doing. Thank you so much for attending this webinar and others. Bill, it's been phenomenal. Thank you so much for your time. I know you are busy. I know you are very hard to get off. Being here with us is very humbling and really appreciate your time.
Thank you, Chadi. I appreciate it. It's been a great conversation. I hope everyone the best out there, and I hope you all can find better journeys to help yourself along the way. Thank you.
Thank you so much and have a good night.